Welcome to the MRCS Bite session on kidney. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Overview of structure. Retroperitoneal organs, right lower than left on account of the liver. 12 by 6 by 3 centimeters. The left hilum lies just above the transpyloric plane, which passes through the superior pole of the right kidney, enclosed in fibrous capsule and embedded in renal fat, which is itself bounded by Gerota's fascia. This is attached to the renal pelvis, but there is an inferior opening through which pus can track in renal disease, divided into outer cortex and inner medulla. Cortex contains nephrons, and the medullary tissue contains collecting ducts and loops of Henle. Cortical pyramids lead into the papillae, which lead to callus that drain into the renal pelvis. This, in turn, leads to the ureter. Pyramids are separated by columns of Burton. Hilum of the kidney medially transmits vein, artery, ureter, artery, VAUA. This is the order from anterior to posterior. Relations. Posteriorly, diaphragm, quadratus, lumborum muscle, psoas, medially. Subcostal, iliohypogastric and ilioinguinal nerves, 11th and 12th ribs. Anteriorly, liver, second part of duodenum and hepatic flexure, right. Spleen, stomach, pancreas and splenic flexure, left. Superiorly, suprarenal glands, pleural reflection, also posterior to upper poles. Blood supply and lymphatic drainage. Renal arteries bilaterally, branches of aorta, renal veins drain into the inferior vena cava, IVC. Lymphatics follow the renal arteries to para-aortic lymph nodes. What is the clinical significance of a left varicocele? The left testicular vein drains into the left renal vein, the right directly into the IVC. A renal cell carcinoma can invade the renal vein, and this will lead to obstruction of the gonadal vein. The first presenting sign of this may be a varicocele. These tumors may be silent, and these patients should undergo renal ultrasonography. Nerve supply. Autonomics from the renal sympathetic plexus are distributed via the renal vessels. They mediate pain and vasomotor tone, development and anomalies. The definitive kidney, or metanephros, is induced by the primitive ureteric bud from the mesonephric duct to form from the sacral intermediate mesoderm. This happens at day 32. The ureteric bud itself is induced to branch by the metanephros. These branches become the calluses. The metanephros ascends from the sacral area to the lumbar region. Failure to ascend results in a pelvic kidney. The kidneys may fuse during ascent and get caught under the inferior mesenteric artery, and this leads to a horseshoe kidney. For more MRCS Part B resources, please visit mrcsbites.com.